Hello, everybody. This is Ron Irwong. You have arrived at the midday download brought to you by CAQH. We're talking about the hidden cost of calls. This is related to the provider directory problem. As I said, I'm Ron Irwong, and I'm joined by my colleague Hassan Sohail.
Hi, everybody.
Let's go to the next slide. So that's our picture and our email addresses if you're interested. Okay, let's go to the next slide. So here are some housekeeping instructions. So just the session is going to be recorded. You'll be able to access all the information afterwards if you've been on the mailing list. Your phones will be muted during this time. So if you have any questions, feel free to enter your questions in the question panel on the bottom right there, and then we will answer them as appropriate either during the session or afterwards during the Q&A. Okay. So just a little bit of background on CAQH before we get into the topic at hand. We've got three big departments. We've got core, which is responsible for operating rules, solutions, which is ProView and Direct Assure and all the rest, and then explorations, which is our index report. It's all. I think we just had a new one, so you can download it on our website. So if you're interested in kind of benchmarking yourself, that's all available there. Okay, we're going to go ahead and get started on the actual topic at hand. I'm going to hand it off to my colleague, Hassan.
Thanks, Ron. So the topic of today is the hidden cost of phone calls as it pertains to provider directories. And we thought a good way to start the discussion would be to just get a little bit of context around why all of a sudden health plans are starting to contact their providers and really increasing the number of phone calls they're placing to attain the provider directory and demographic information. So what we have on the screen is some data. CMS has advocated that Medicare Advantage organizations should contact their network on a quarterly basis to update the provider directories, Ron.
Yeah.
However, it's interesting. They haven't really prescribed a method of contact.
Yeah.
They've just said you should contact providers in the method that is the highest likely to get a response rate.
Yeah.
At the same time, CMS also has conducted audits around provider directory data. And when they conduct audits, they place phone calls. And they select providers from, they'll select 100 providers from a health plan's directory and they'll call them up. So it's interesting that they're not being prescriptive, but they've de facto established the best way they think to evaluate this issue.
Like if the plans are viewing CMS as, the teacher or the grader, and they know that they're going to be graded on phone calls, they're going to try to do phone calls themselves, right?
Exactly. But you know what? There's another reading into what we see here. And for me, it says on the left-hand side, basically, it seems like CMS is sort of leaving the door open. They're saying there might be a better way to do this. The industry maybe can figure out, and I think in some of their documents, they have said, we want to encourage folks to be in this space to figure out how you can get accurate information from your providers. But at the same time, they're saying phone calls are what we think right now are the best way to do it. So there's some hope here in that I think this also leaves us room to be creative and arrive at a solution which we think is going to be best for all stakeholders.
Yeah, they've actually explicitly acknowledged some industry initiatives in some of their annual reports. So looks like they are leaving the door open for innovators to arrive. Yep.
Right. Let's go to the next slide. So we did a survey of about 90 participants from over 60 health plans, and we tried to gauge, what's the state of the industry with regard to outreach for provider directory data. So Ron, again, it seems like while CMS is not prescriptive on the mode of outreach, a large majority of the plans are choosing to make phone calls. Can you give us some insight into why that might be, and what are some of the things that led them to go down that route?
Well, Hassan, I know you talked about how CMS is doing in that, because CMS is auditing using a phone call methodology, many health plans are choosing to do the same thing. So as you can see in this graph here, you've got about 72% of health plans are performing some type of network-wide outreach via phone. And then you've got similar, direct outreach methods to be able to get updates as well, like fax and US mail. hodgepodge of other solution approaches like portals and analytics and probably inclusive of some of these claims analytics approaches. But by and large, plans are definitely defaulting to the phone approach because CMS is doing it, but also it's just something that they're used to and they have channels to be able to consume those updates, right?
Right. And some of them may already have call teams for other purposes in the health plan operations.
Yeah.
So there's a school of thought that says, phone calls may not be ideal for the industry, but if phone calls are working, why stop? So but we really have to ask the question, are phone calls working? Are they giving us the accuracy increases that we as an industry expect and CMS as a regulator demands of us?
Yeah.
So we can go to the next slide. We actually asked participants around how much their directory access has increased as a result of some of the outreaches they've told us about in the previous slide. So, Ron, it's very clear. It seems like while most people are making phone calls, accuracy increases are quite modest.
Yeah, you're seeing right here, you see a little bit of a bell curve, and the average health plan that is performing this network-wide outreach is getting at most 10% accuracy, which if you think about it, if the average health plan is around 50% accurate per the CMS reports that we see, that's actually not changed in the past 2 years, as unfortunately. They're only getting to about 60% accurate. So for those of you on the line, you have to ask yourself, if I'm 50% accurate right now, I'm spending all this effort to make phone calls to every provider at every location, and I'm only able to get myself to 60% accurate. Is that worth the effort? Is that worth the cost? You see a handful of plans that are getting more, and then actually some that have seen decreases in accuracy since the last year or so. But by and large, it's around 10%.
Yeah, I think one thing that's clear to me from this graph is just doing phone calls is not enough. And if you want to be successful even using phone calls, you have to do it in some kind of controlled manner. You sort of have to know what your processes are, and you have to be very intelligent about it. So just like any other solution, you have to approach it from a strategic standpoint.
Right.
Let's go to the next slide. So here, I think we kind of really lay out the real hidden cost of phone calls. And I think we wanted to talk about what the industry is doing based on some of the data we've gathered. But let's talk about the impact this is having and what's sort of behind the scenes. So Ron, do you want to talk a little bit about the provider impact?
Yeah. So we've been monitoring the provider situation around phone calls for the past 2.5 years or so. And increasingly, every single year, more and more providers are saying they're getting more and more outreach. And that just hasn't let up yet. Some practices we've seen here, a couple of anecdotes where practices are receiving up to 100 calls or faxes a week. And there have been some cases where plans have been performing outreach that's so aggressive, like they are, like I mentioned before, some plans are calling every provider at every location, and they're doing that on a quarterly basis. Now, for those locations that have 40 or 50 providers listed, that's an enormous number of phone calls to receive. And if they were happening all at once, if the plan isn't spreading them out over the quarter, we've heard of cases where the patient appointment phone line was clogged up and patients weren't able to get through to make appointments. So, as it turns out, the intervention that the plans are pursuing to make the patient access problem better has actually resulted, at least temporarily, in worse access. So it's unfortunate. I know that that's just part of the equation. Well, Hassan, you've heard some other examples as well.
Yeah, I was talking to one provider organization, and they were complaining really about the state of affairs today and the fact that so many plans are making phone calls, and they get so many phone calls, sometimes from the same plan repeatedly, within the same quarter, because they're different verticals of the organization calling them.
Yeah.
And they said they've implemented a policy where they no longer respond to a request for demographic updates over the phone, and they'll only respond if it's submitted in writing.
Yeah.
And the reason they said this is because A, they don't want to waste their time.
Right.
And B, they want to say that, hey, we submitted this once, take it, stop asking us over and over again.
Right.
So you're also starting to see some of these provider organizations start to push back. And what this tells me is, that this approach while we as an industry may have started on this route, may not be this, probably isn't the sustainable route. The other side of the hidden cost that we're now going to talk about really is on the health plan side. So again, we said folks started using phone outreach because it was something they were familiar with. CMS is using calls to audit.
Yeah.
However, from a financial and monetary standpoint, it is expensive.
Yeah.
We've calculated about $10 to $12 per outreach per provider. Sorry, per annual outreach per provider.
Yeah.
And really, the way we got to this number, and we've spoken to a bunch of health plans, is you have to hire resources to perform this outreach. Not only do you have to hire resources, any gains you get are point-in-time gains. So you continuously have to spend the money to get the value of that resource.
Right.
And as I said, if you take that as a holistic industry numbers, you can end up with the industry spending millions of dollars on this problem.
Yeah.
Let's move on to the next slide. So I think this is probably the most interesting slide here. We actually have an example of a health plan that we work with, and they laid out their approach to outreach over the last 2 years, and then we'll also talk about some of the successes and the failures they've had. So, Ron, let me start off with their 2016 timeline, which is at the top in the yellow, and then you can walk us through the 2017 timeline and what we think they did and some of the adjustments they made. So in 2016, as with most plans, they said, provider directors are inaccurate. CMS is saying that health plans are responsible, and they started working with a call vendor to like most of the plans, to validate this information. They hired a bunch of staffers and they had a bunch of contractors to start loading the data as the callers are calling them. And they got about a 55% response rate, not bad. And their accuracy did improve. Now, again, looks like about 14%. So promising, right?
Yeah.
And I think their thought process was we got some good results. We got from, starting at around industry average to a little bit better. But our response rate was only 55%. Let's sort of double down on this strategy and see what happens in 2016 moving forward.
Yeah, so they definitely thought that more was better, and that, well, we're going to staff some more contractors to consume the data and to make more phone calls to provide greater coverage across our entire provider network. Of course, they were introducing some file exchange or roster exchanges with these larger groups as well. And then they were inserting some incentives and disincentives. So for those groups and providers that were attesting in a timely fashion, they had contractual levers to be able to provide some monetary incentives to those groups. And then they had some disincentives for those who weren't responding in a timely fashion. So they were able to get a higher volume of updates, which was costly to obtain and also costly to consume downstream in the internal systems. And the attestation rate was pretty good. That being said, their accuracy went down. So from starting off at the beginning of the year at 71% to 63%. So I think what it shows is that simply getting more responses, which kind of goes back to the CMS guidance that you should take the method of outreach that is going to get you the most responses. That's actually not necessarily going to get you the most accuracy. If you're only incentivizing a response, then you will get what you incentivize, which is a response. You will not necessarily get more accurate information.
That's right, and it's something that sometimes is not clear up front.
Right.
But the point I got from this story and from their story was that you really have to look at this problem strategically and incentivize the right things. If our goal is accuracy,
right,
then maybe we can employ a different tool to comply with the quarterly outreach requirement.
That's
However, use these strategic learnings in order to improve the accuracy gains.
Right.
So if we can move on to the next slide, let's talk about some of the lessons learned. So on the left-hand side, as Ron mentioned, they found that their attestations improved, but they weren't able to get the quality of results that they wanted. And really, it looked like the accuracy went down, right?
Mm-hmm.
And part of the reason for that is the providers are really fed up.
Yeah.
You're all of a sudden, they created a new vendor portal. they're calling these providers, they're asking them to come into the system. They're saying, we'll give you some reward if you attest. And providers seem like they're being overwhelmed and being asked for the same information over and over again. At the same time, the provider community, they also didn't really understand the implications of what they were saying and what they were attesting to. They didn't know how it could impact claims. They weren't really sure how this information was really used. So that part of the problem was also unclear and really wasn't presented to them. And then lastly, they had some very tight timeframes for attestation. And they realized that because of these tight timeframes, the providers weren't able to follow the accurate protocol, and they missed deadlines, and there were some negative consequences for those deadlines, but they also weren't in a place where they wanted to enforce those consequences. So there was the whole strategy didn't really play out as well as they wanted. But Ron, do you want to talk a little bit about some of the actions they're looking forward to doing, and they've already done since end of last year?
Yeah, so the major actions here is that they're rationalizing all of the outreach and eliminating the vendors that they're using to get these attestations. They're going to be using CAQH, Direct Assure, as the tool to be able to capture the information and the attestations. They're going to be depending on a really compliance-oriented outreach, so that it's not abrasive, but it's just for compliance purposes. And then they're going to be implementing some business rules that have kind of emerged as a result of some industry collaboration among health plans, so that the data that's coming out of the Direct Assure solution can be acted upon very quickly and can have a solid impact on their directory accuracy.
Yeah, and one point I want to make here is, they came to us and said, our providers are saying, why are you asking us to respond to this information over the phone? Why have you created a new portal? This information is in CAQH. I put this information in ProView. Every time I attest, I keep it updated. Why don't you use that? So as I said, we've said this before. We keep on hearing it again and again from our providers. And I feel like that's sort of the reason why they've said, okay, this plan has said, we've heard the provider community. We're going to rely on the CAQH attestation. At the same time, they're taking advantage of our Direct Assure solution and its latest capabilities to improve accuracy. And I believe they're going live sometime this summer.
I think just to piggyback off a little bit, they're also using that provider directory toolkit, which is available publicly and free for any health plan.
That's a great point, Ron. All right, so if we go to the last slide that we have today, let's talk about what should health plans consider when they're transitioning from really an outreach-centric approach to an optimal mix of accuracy improvement strategies, right? So we talked about the current state of affairs. We have a lot of health plans that are currently doing a lot of network-wide telephonic and phone outreach. We saw in that graph that there was some U.S. mail as well. I'm not sure how effective that is, but again, it's one of those things that people are used to doing and they have processes to do. So they continue to do what they used to do in the past. Exactly. And then the other piece that health plans are currently doing is they are consuming some passive updates to health plan specific portals. And there are multiple channels for this information to get into the health plan system. So we haven't seen really health plans starting to take aggressive action or strategic action on where this information is coming from in the source systems. Ron, can you summarize for us what these plans can do in the future and how they should really optimize their strategies in order to get the best result, both for their providers and obviously for their own teams?
Yeah, so I mean, this is kind of synthesizing what we had seen from the other plan that we just talked about, but outreach is still important. So we're not saying to not do any outreach, but it needs to be targeted. So I think focusing outreach on known offenders or groups that are historically reporting inaccurate data, that's going to give you the strategic outcomes that you're looking for. And then as an incentive for those other groups that are submitting good data, deprioritizing or just not performing as much outreach to those guys as well. In addition to that, making it as easy as possible for providers and groups to be able to provide, to submit the updates that health plans need. So that's really snapping into a one-stop shop type of platform and an industry-wide place where they can do it on behalf of all plans. And then, in addition, there's the education part of it. So outreach needs to be targeted, also needs to be insightful. So, I mentioned the provider directory toolkit. There are also, other ways as a health plan you can align with your provider community on the definition of accuracy, and that's going to help you get better results. So I think we've got a little bit of time for some questions here, maybe 1 minute. So got one question that came through the channel here. So there's a question about how are providers convinced to go to the portal?
So I'm assuming the question is about the health plan that employed this tactic in 2017. They the vendor created a portal, and what the health plan did was they incentivized their provider organizations to go in and attest.
Yeah.
And because of that, and the previous year of the vendor calling, they established some incentives with their providers to say that if you attest X many times within some time frames, they'll get some additional compensation.
Yeah.
And because of that, providers they clicked the attest button. They clicked it furiously. Yeah. And because providers are motivated, and everyone is motivated by incentives. Yeah. However, the result, the lesson to be learned here is that while they spent a lot of money in doing that, they got people to come into a portal to update some information. The information was just as bad, and it was not beneficial to the organization. It did not meet the goals of improving accuracy. And to piggyback off of that, if the question is about why are providers coming into the CAQH portal, because we do have a portal, that's where providers come in, and that's what the organization moved forward with after saying we don't want to rely on a vendor portal. We already have a portal. Providers are coming into the CAQH portal because they're regularly attesting to their information. They've been doing that for a number of years, and they trust it. And it's a multi-payer platform. So they know that if they put information here once, it's available for many providers to use and see. So it's something that, we have a very good response rate, between 75 to 80% within the 120 days for a large majority of providers. Yeah. So we're pretty confident that providers come into our system without us prompting them to, because they see the value of it. It's kind of apparent to them.
So how many, do we have time for maybe one more question, or?
Yeah.
Okay, one more question? Okay, so got a question here about how does DirectAssure address the accuracy via the CAQH portal? I know this is a topic that we'll be able to go into a little bit more detail in our next midday download, which is about, getting to the safe zone. But, just to summarize real quick, our new DirectAssure capability allows plans to make their data that they're publishing in their directory available to us. We'll compare it against the data that the providers reported and bring the provider into the discussion to help them reconcile what data should be published within a directory or not. So it's contextualizing around how the data is going to be used and also giving them a channel to update.
It's a great summary, Ron. The way I tell folks, if they're not familiar with our the latest features of DirectAssure, is we're basically think about DirectAssure as a filter for your organization's provider directory database. And you're sending us your data, and you're filtering it through our system and outcome locations, which you have good confidence that you can publish, and a subset of locations which the provider has said, no, I'm not working here. That's an old location, suppress it. So if you have more questions about how the solution works, and really if you want to get into more details, please do contact one of our sales team members. The email's on the slide here. They can give you a demo, and they can give you an overview. If you have more detailed questions, if you want to learn more about the topic, you feel free to reach out to us. Our emails are also on the slide as well.
Yeah, but we see a couple of questions that we weren't able to get to. We'll get back to you guys after the call and make sure that your questions are answered. So we appreciate your attendance to the midday download, the hidden cost of calls. We'll provide some more information on our upcoming webinar in a couple of weeks, so we'll let you know. Thank you for attending.